Hello, I'm Whomsley, a fourth year physiotherapy student. In this video, I'll take you through my graduation project in which I researched the topic of survival rates of prosthesis in knee arthroplasties. The question that I have tried to answer with this research project is the following. What is the recent evidence regarding survival rates of the prosthesis in UKA compared to TKA for osteoarthritis patients? Here's an insight into my research methodology. The only database that was used for this research was PubMed via the Fontes environment. My final search string, which was partly discussed with two research experts, being Liddy van Breugel and Helene van Schelven, is included in this presentation. It initially produced 1100 results, but then produced 517 hits by using the 5-year filter, as the intention was to include the most recent studies. Here are the inclusion and exclusion criteria which were continuously applied during the screening of the search results. Inclusion criteria included articles in which the study population is osteoarthritis patients, secondly, articles comparing UKA with TKA, and lastly, articles in which the outcome measure is indeed the survival rate of the prosthesis. Exclusion criteria included articles that had been published more than 5 years ago, that were dealing with lateral unicompartmental knee arthroplasty, and articles which were not available in full text nor in English. This flowchart illustrates the screening process that I followed to exclude a number of articles. The final number of studies included in the literature review was 9. This is the list of the final 8 research results I came up with, including the names of the authors and titles of the studies. One additional study was added to this list with the snowball effect. All selected studies were carefully reviewed, with the summarized conclusions of every single one of them included in this table. The main findings from this study are that UKA and TKA are both viable options for the treatment of osteoarthritis. Also that 67% of the included studies actually found higher revision rates for UKA than TKA, which would suggest a lower survivorship for UKA. However, 44% of the included studies describe a significantly lower postoperative complication rates after UKA than TKA, and moreover, younger age, operating surgeon, hospital volume, as well as diabetes and cementless fixation are risk factors for failure, which would significantly impact the survivorship of the implants. And finally, shorter surgical duration, lower estimated blood loss, and quick hospitalization length have been observed in UKA. Finally, while these bits of information should all be available to patients and surgeon as part of the shared decision-making process when choosing between UKA and TKA. Here is a list of limitations I observed in my research, as well as recommendations for follow-up research. One of the main pitfalls of my research was the use of one single database, which considerably reduced the possibility of getting results. Quality studies may have been published elsewhere than PubMed, obviously. The second limitation I found was the clarification of the term survival rate as an outcome measure. I would recommend a clear definition of the term to understand the scope of the concept. Thirdly, the exclusion criteria perhaps were too selective, which led to fewer results. No age criteria included leaded to some ambiguity in the study selection process. And finally, human error or my student research inexperience may have led to misreading or misinterpreting of titles or abstracts, which would have led to deleting some potentially interesting articles. Thank you for watching this video. I'd also like to take this opportunity to thank everyone involved in my research project.